Hello everyone, and welcome to the latest in the series of TCCA Critical Update webinars. My name's Tony Gray, and I'm Chief Executive of TCCA, the global representative body and advocate for open standards for the critical communications sector. Today's webinar is presented by Paul Bremner of Omdia and focuses on the challenges and opportunities presented to the critical communications sector by the COVID-19 pandemic. We have attendees from around the world, so we're looking forward to an informative and valuable experience for everyone. We're keen to have your reaction to the live polls, which will pop up on your screens during the presentation. Simply choose an option and click Submit to send your response. Also, please submit any questions you may have during the course of the webinar using the questions pane on the right-hand side of your screen. If you're on a mobile phone, this appears at the bottom of the screen. If there's time immediately after the presentation, Paul will answer as many as possible, and any that don't get addressed during the webinar will be responded to afterwards. Paul's slides will be available after the event, and there will be a recording of the webinar available online. Plus, we'll also be circulating a document containing all the questions and answers. So now I'm pleased to welcome your presenter for today. Paul, the floor is yours.
Thank you, Tony. Very happy to be here today. And today I'm going to be sharing our research findings from the last 6 months on specific industry challenges and opportunities that have been created from the COVID-19 crisis pandemic, as well as some of the challenges and opportunities that we see going forwards in the sort of medium and longer term as well. So, as I say, I'll talk about some of the industry challenges in the shorter, medium and long terms. I'm going to talk about the impact that some of those challenges have had and how that impact translates for various sectors across the critical communications industry, various geographic regions, various technologies, and so on. And I'm going to finish by outlining a couple of future scenarios that we have here at Omdia that we see in the next few years. Throughout, as Tony has mentioned, there will be poll questions, so please do get involved and answer those poll questions, and hopefully we can make this a little bit more interactive. I'll start by just letting you know a little bit more information about Omdia. If you are not aware of who we are, Omdia is a large market research company. We are owned by Informa. We are part of the Informa Tech division. Informa itself is a FTSE 100 listed UK company. We have offices around the world. We have around 11,000 staff in about 30 plus countries. Omdia itself is a relatively new brand. We launched the Omdia brands in February 2020. It's a combination of a number of different research houses, from Ovum, Light Reading, Tractica, and finally IHS Markit, which was acquired in August 2019. Our research coverage spans a wide range of industries, from components and devices through to cybersecurity, IoT, media and entertainment, and then finally the industry vertical, where our public safety research sits. The public safety research broadly is split into video surveillance and critical communications areas. And what I'm going to be presenting today is a combination of a number of analysts within our critical communications team, covering the critical communications broadband market, the mobile radio market, and then my specific area of coverage, which is the command and control rooms market. So I want to start by giving a bit of background to COVID-19 and really lay out some of the assumptions that we are working under here at Omdia. COVID-19 has been a black swan event for the world. For those who maybe have never come across the term Black Swan event before, it was an event that was entirely unexpected, unpredicted, and it has impacted industries and countries in varying degrees. It's forced people, companies, and countries to adapt and overcome. So I want to start the webinar with a short poll question before we move on, and it's in line with the title of this webinar. How would you classify the impact of COVID-19 on your organization? Before I have the chance to sway anyone to one side or the other throughout this presentation, does our audience currently think that the impact so far has been more of a challenge, more of an opportunity, or other? We have run this presentation. This is the second presentation we've given today. We had some interesting results from the first poll, from the first presentation from this. So it will be interesting to see whether or not our audience this afternoon for me in the UK, this morning if you're in the US, if they are feeling the same as the audience this morning. Okay, so we have around 2/3 of our audience thinking that the impact of COVID-19 has been more of an opportunity for the critical communications industry so far, which does actually align with the poll results from this morning's presentation, or the earlier presentation, I should say. So it's very good news to hear that most people are seeing this as more of an opportunity than a challenge. Certainly, the impact as laid out on the slides and the long-term implications varies by country, by vertical market, whether it's public safety, transportation, utilities, the market sectors, and the technologies within those market sectors. So we'll talk a little bit more about each of those as we move through. A couple more slides on the background of COVID-19. At the moment, we are, I believe, reaching almost 30 million cases worldwide. We crossed the 1 million plus mark back in April, so it has been quite an increase over those last 5.5 months or so. But the pandemic is not playing out in the same way from place to place. So countries such as China and New Zealand have reached a very low level of cases after lockdowns of varying lengths. And we've seen those begin to ease restrictions while watching for flare-ups. Elsewhere, other countries such as the United States and Brazil, we've seen cases arising fast after governments lifted lockdowns fairly quickly or never activated them on a nationwide level. Finally, Europe itself is bracing for a second wave as we move into winter. We're already beginning to see cases in this region start to pick up in a number of countries. So, final slide here on outlining how the impact really does vary on a very granular level. The Center for Infectious Disease Research and Policy suggests that the COVID-19 outbreak won't end until 60 to 70% of the population is immune. The earliest vaccine is not likely until the end of 2021, and when it is available, it's unlikely to be available widely. So in all, this means that it will be a very long-lasting impact, and the pandemic itself is widely expected to continue through to 2022. The map that I show here on this slide is the expected daily confirmed cases by country. The map itself is actually taken from the website epiforecasts.io. I actually got this map around 4 weeks ago now, 14th of August. But you can see at the time that the picture of where cases were increasing, where they were decreasing, is very mixed, and it is on a very specific country by country basis. Now, I looked yesterday to try and update this map to a slightly more more up-to-date version. And I think the map that Epiforecast is showing at the moment, for me, sums up 2020. The majority of countries listed are now listed as unsure, which I think unsure is a good word for how a lot of 2020 has gone. So that's the background in terms of COVID-19 and its how its impacts will vary on a country-by-country basis. Now, I want to move to the specific industry challenges that we've seen over the last 6 months in the very first phase of this pandemic. And we've seen many challenges for first responders and public safety organizations, many of which emerged in the early days of the pandemic. The first of which was the increased surge demands on healthcare services, with hospital wards being quickly repurposed into COVID-specific wards, and in some instances, entire field hospitals being built and set up in a matter of days in anticipation of that surge. The second challenge is listed here with lockdown rules coming into effect and mass gatherings bans. It put additional demands on policing resources, and policing shifted away from the traditional functions. I've included a quote from Richard Walton here, who described the pandemic as representing the biggest challenge to UK police since the Second World War. Now, that was offset somewhat by reduction in traditional policing functions, so things like alcohol-related disorder and mass events, obviously, which weren't allowed to go ahead. And then there were the social distancing requirements, and this was particularly acute within control rooms, which by their very nature tend to be filled with people all working in quite close proximity and tend not to have a whole lot of extra space which isn't already allocated, in which staff could expand into. And then finally, the requirement to maintain staffing and service levels throughout has been a particular challenge. And I think the prime example of this specific challenge comes from New York City, where in late March, as the pandemic was at its peak in New York City, nearly 19% of NYPD cops had called out sick as coronavirus spread through their ranks. And to put that 19% of the force into perspective, that was nearly triple the department's average sickness rate. So I want to ask the audience here again. I have a second poll question. I'm interested to know what measures your organizations have undertaken as a result of COVID-19. So we have enhanced cleaning regimes, minimum staffing requirements and staffing contingency plans, updated continuity of operations plans, staff health screening and staff medical policy updates, or an activation of a backup facility. Control rooms would be a good example here, where primary control rooms were contaminated potentially, and a backup facility was activated. Now, there weren't too many surprises, I don't think, from this question from the first run. So it'll be interesting to see again if we can compare our audience today with the earlier audience. So we have 100% enhanced cleaning regimes. Second, we have updated continuity of operations plans, no activation of backup facilities, and then joint with the minimum staffing requirements and staff health screening. So not too different from the first time we ran this presentation, this webinar. The first time, some people had actually activated a backup facility, and perhaps surprisingly, the first time it wasn't 100% enhanced cleaning regimes. So it's good to see that our audience do have 100% on that one. So a little bit more on the specific critical communications impacts. Some other impacts that we've specifically seen over the last 6 months. The first one listed here, surging group voice demands. As requirements for emergency medical services, surge capacity, added temporary patient transport capacity. We also saw that command and control of these resources exhausted equipment caches, current equipment caches of Tetra or P25 push-to-talk devices, which was leading to new LTE-based deployments. The second one here, we saw that control room agility became vital. So that any sort of contamination of primary dispatch sensors was creating the need to relocate to secondary sensors or activate those backup facilities if they existed. The support for home-based call takers grew and ultimately led to increased adoption of cloud-based dispatch software. The final point here, projects slip or cancelled. The prospect for delayed projects as municipal staff were diverted to frontline operational responsibility, and the long-term loss of tax revenue jeopardizing future projects that don't have locked-in funding currently. So if we look at this from a market sector perspective, towards the start of the presentation, I mentioned that we have specific research on mobile radios, critical communication broadbands, and then command and control rooms. So I lead our command and control room research, and we have a team of analysts on the mobile radio and critical communications broadband side as well. So what I'm showing here is essentially what we as a research team put together around April-May time, and really as our initial thoughts on what the COVID-19 impacts were going to be for the critical communications industry. So if we start with the LMR, PMR systems, the revenue impact was expected to be quite negative. So projects being delayed, growing importance of hybrid LTE, LMR solutions, and a wholesale substitution of LTE for LMR in the infrastructure. On the control room side, I expected it to be quite neutral. Increased home working, likely to speed system refreshes and upgrades to enable that home working. Projects likely to be delayed, but ultimately an accelerated shift to cloud-based architectures. And then finally, on the critical communications broadband side, we expected that telemedicine would accelerate mission critical LTE adoption, and that the requirement for wireless routers was going to grow to serve those field hospitals that were being set up. So we have the sort of expected duration of each of those impacts listed. You'll see that for the 6 months, the dot is on the right going backwards. That's essentially because, as I say, these were initially created when the crisis was initially hitting its first peak back in around April time, and as lockdowns were implemented, that led to immediate project delays. That has eased somewhat, but obviously there's a knock-on effect. It's very difficult to then catch up. If we look at the growing importance of hybrid LTE LMR solutions going forward 1 year, it's likely that will continue for more than a year, but it's not going to be as long term as the wholesale substitution of LTE for LMR in the infrastructure. Now, as mentioned, these were our initial observations back in April. I've actually, as we've gone through the year, we have some more information and some more data come into us. So we have some numbers which I can share with you. For LMR, PMR systems, we've seen that negative revenue impact translates to around sort of -30, -35%. For control rooms, it's broadly neutral. We see anywhere from -10 to +5%. And the variation here within control rooms specifically is mostly down to the variations within countries and within regions. As mentioned, the crisis itself has been felt in varying ways and also at varying times by those different countries, and that has some effect as to how that translates to a revenue impact. And for critical communications broadbands, it's been really around nothing to +10% sort of revenue impact from this. Obviously, we're likely to only know the full impacts for 2020 from a revenue perspective once we're well into 2021. But from first half results from publicly listed companies so far, it's clear that there have been winners and there have been losers through this first phase of the pandemic. It's likely that those winning or losing streaks will continue, and the pandemic is merely acting as an accelerant, if you like, of those underlying trends which existed in the marketplace beforehand. Some more sector and geography specific or geographic impacts here. First, public safety projects have seen their schedules shifted, either due to emergency staff deployments back to the fields or simply because local lockdown rules prevented any further work from being carried out in the original timeframe. These projects tend to be on fairly long cycles, so for the most part, they've simply been shifted backwards out in time. For non-public safety projects, the story is slightly different. The collapse in public transport ridership numbers will bring in a multi-year impact. Some providers are likely not to recover from that. Many public transport networks saw ridership numbers decrease almost 90% at the peak of the crisis. So the example I like to use here is Transport for London's ridership numbers, which were down 88% by late March and more than 90% down at the peak of the lockdown here in the UK. Now, since the UK's lockdown eased through May, June, July, August, the ridership figures have increased, but only to around 60% of their pre-pandemic levels, which for an organisation which derives around 70% of the revenues from ticket fares is pretty disastrous. In fact, I like to use this example because TfL, Transport for London, have already been bailed out by the UK government with £1.6 billion in emergency funding provided in May for them to be able to keep tube and bus services running until September. And then there is another £2 billion being asked so that they can see themselves through to the end of the financial year. And that continues to balloon to a potential funding black hole of £5 billion. So obviously this is only one example of one provider, but the story holds true and is the same in many other cities, many other metropolitan areas. Radically decreased ridership figures will ultimately lead to projects being put on hold and put question marks over the future of other developments. Now, utilities find themselves somewhere in the middle between public safety and transportation. For many, the critical nature of what they supply means they've continued operating throughout, although the utility companies that derive their revenue from ratepayers, either directly or indirectly, are likely to see lower rate-paying revenue as we move through the sort of COVID-19 induced recession. And that's likely to limit CapEx expenditures and again place question marks over any future projects. And then finally, we have some geographic impacts here. So we've seen both Europe and Asia outperform the US in their response to the crisis. They've had consistent national lockdowns, which successfully reduced the strain on medical systems. For the most part, effective test and trace programs enabled the reopening of the economy in a safe manner, or as safe as can be in a pre-vaccine world. And then economically, specifically in Europe, the support for workers in the form of cash injections for loss of wages has boosted consumer confidence. So in Europe, many workers who have been furloughed, which is they had been told to stop work, have had their wages replaced by the government. So in the UK, this scheme runs through to the end of October. Other countries, including France, Ireland, and Germany, all have fairly similar wage replacement schemes in place. In Germany, actually, they recently announced that they will extend their scheme for another 24 months. And these schemes have been vital in supporting workers who couldn't work while their countries were locked down and while certain restrictions were in place. And they provided a confidence boost to consumers as those countries then began reopening. So on the right-hand side, I wanted to talk about this graph as well. I wanted to highlight how these impacts have affected the control room market in particular. So the graph shows our pre-pandemic forecast, the previous forecast from the 2019 Command and Control Rooms market report, alongside our latest 2020 report forecast, which takes account of COVID-19. So the previous forecasts, we were expecting to see growth rates of around 5.5% for 2020. But the COVID-19 impact translates that to a minus 3.6% reduction in market size for 2020 for the control room market. As we've seen from the previous slides, that there is some variation in this figure for different regions and different sectors, but this is the global total market view. So obviously the pandemic has had a very profound impact on everybody's lives and this industry in particular. So here at Omdia, we've outlined two potential scenarios for the future of the critical communications industry, and I'll briefly outline them here, and hopefully I can, or well, maybe not hopefully, but it may sway some of you, and we'll have a poll question after these to see how people are feeling. So the first positive scenario we've called COVID-19 crystallizes change. So in this scenario, the crisis acts as an accelerant. So organizations which had started to refresh control rooms in order to benefit from recent technological changes see the benefit that they can bring both to first responders and to the efficiency, resiliency of the control rooms themselves, and further commit to supporting those control room refreshes. So in this scenario, we see an increased speed of adoption for a number of technologies, which includes NG911, 999, cloud-based control rooms, and body-worn video in particular. And I've included here a quote from Steve Sounder, former director of the 911 Center in Fairfax County, who uses the term blessing in disguise. So I really see what the virus is exposing in terms of options and opportunities as be really a blessing in disguise. And from the first poll question at the start of this presentation, it seems like many of our attendees would agree with Steve on that front. In the second negative scenario, which we've termed recession reduces refresh rates, The wider economic environment we expect will have a large impact on the market as governments may rein in spending or reallocate budgetary spend towards other industries which are deemed important for their economic recovery. So commercial activity in both the transportation and utility sectors is likely to continue to remain low as companies look to reduce their capital expenditure in any areas that are deemed non-essential. And those actions will ultimately feed through to the critical communications market in the form of longer cycle refresh rates. So for control room upgrades, for equipment refreshes, for really every aspect. And there's some additional weight, if you like, to this future scenario here is a survey which was conducted by the National League of Cities and United States Conference of Mayors. It was conducted earlier this year and published in April 2020, provides some weight. So the survey found that municipal budgets were hanging on by a thread. 88% of local leaders were anticipating revenue reductions this year, and those losses would force local leaders to cut critical public services and reduce their workforces. So they found that nearly a third anticipated furloughing employees, a quarter anticipated layoffs, and importantly, more than half were anticipating funding cuts for police, and more than 1/3 were expecting cuts for firefighters and EMTs. The situation was particularly acute for cities in the 50,000 to 500,000 population range. Currently, it was only cities with populations above 500,000 which are eligible for direct funding through the CARES Act, the coronavirus relief funds. Now, I've outlined at a very top level those two scenarios that we see going forwards, one more positive, one more negative. In all likelihood, the future will be some combination of these two scenarios, but I wanted to take this opportunity to go back to our audience and make this a little bit more interactive with our third poll question, and ask you, which future scenario for this industry do you think is more likely? Given your experience and given what you've heard from the presentation today, do you expect or do you think that the positive COVID-19 crystallizing change is more likely, or that the recession reduces refresh rates is more likely, or neither? And as mentioned, this is our second run at this webinar today, so I can share with you the results from the first run as well. We had a very positive audience going into this presentation, so it will be interesting to see if that continues. And we have, yes, we do. We still have a very positive audience, COVID-19 crystallizing change. And actually, from the first run of this webinar earlier today, we had very similar results where the majority of people thought that it was the situation for the industry is more likely to be positive going forward than negative. So obviously the pandemic itself has had a very profound impact on everybody's lives and this industry in particular. And whichever of the previous scenarios outlined you think is likely, with every change, every challenge brings with it potential opportunity. So I've included a quote here, which I think sums up how this crisis has changed the world around us. Change the way you look at things, and the things you look at change. The crisis has changed what we look at. It's forced us to reprioritize, refocus. Within public safety, the increased requirements for flexibility and resilience is feeding through to the types of technologies deployed both in fields and within the control room itself. So I've highlighted some of these on the previous slide, with cloud-based deployments being really the big winner through this in my mind. And I will turn it over to the audience again one final time today. We have our final poll question, which will go up now. Which 3 technologies do you think will have the most impact over the next 5 years for your organization? We have broadband LTE, NG911, 112, cloud migration, data analytics, and/or artificial intelligence, and then drones at the end there. Now, I mentioned on the earlier presentation that I was somewhat limited by the platform here. I wanted to include many more than this, but the platform only allows 5, so I've had to pick 5, unfortunately. I'm sure there are many more options, and as I said, I had at least another 5 that I would have liked to include. But again, it will be interesting to see if the audience agrees with this morning's audience. So we have joint broadband LTE and data analytics and/or artificial intelligence, NG911, 112, cloud migration coming in second, and drones coming last, which unsurprisingly is not too different from the first run of this webinar. The first run of this webinar, we actually had data analytics and/or artificial intelligence being a standout, well, maybe not standout leader, but in first place by itself. Broadband LTE coming in second, and again, drones lagging. So thank you very much for the participation there, and it's interesting to see that the results do indeed line up between those 2 webinars. So in conclusion, I think COVID-19 presented and continues to present additional pressures onto emergency services. Surging voice demand, flexibility and resilience of control rooms have become vital requirements. But ultimately, the industry picture itself is mixed. It's dependent on market sector, it's dependent on geography, and it's dependent on specific technologies within those market sectors. But I think the takeaway message from what we've seen over the last 6 months is that COVID-19 has ultimately acted as an accelerant of pre-existing trends, rather than completely changing up the industry. What we've seen is the pre-existing trends that were already in place have simply been shifted forwards and accelerated somewhat.
Brings us to the end of today's event, which we hope you've all found useful and enjoyable. All that remains is for me to thank Paul and Omdia once again on behalf of all the attendees as well as TCCA. And please, everyone, let us have your feedback afterwards. And so for now, goodbye, stay safe and well.